Chen Li and fellow students at the Beijing Sports University. He's strong, fit, and agile, all of which he needs to pursue aerobic dancing as part of his physical education studies. But a couple of years ago, Chen was feeling very different. He'd been diagnosed with tuberculosis, a crushing blow that shocked and frightened him.
从刚开始我知道我感染结核病之后，惊恐说起吧。惊恐，但是我拿到电话之后，我听说我感染结核病之后，当时心情非常的低落，一个人走在校园内散步，拿着电话，不知道给谁打。
Equally shocking was the fact that Chen knew virtually nothing about the disease, even though China has the second highest number of TB cases after India. But without knowing it, Chen was vulnerable. Here in the Haidian district of Beijing, about half of the people with the disease are university students. The fact that Chen and so many other well-educated Chinese knew so little about the dangers of TB was a wake-up call for the government and global health advocates. The students knew even less about the growing threat of multi-drug-resistant tuberculosis, which is far more expensive and difficult to treat. That's why the Lilly MDR-TB partnership has spearheaded a program that specifically targets this group. As part of the China University Initiative, which encompasses 34 colleges, these students are being screened and given information about the dangers of TB and drug-resistant TB. They're also getting X-rays in a special mobile unit which has been provided by the US-based Centers for Disease Control and Prevention, or CDC. Those who test positive are immediately assigned a doctor who will provide medication and monitor the patient's progress, all free of charge.
我们之所以这么做呢，实际上也是避免就是他在学校里边再继续传播因为学校是一个比较特殊的一个环境人口密集，再一个他们就是宿舍也好，在一块吃住生活学习就是很容易造成这种传染病的传播。
After a year of treatment, Chen Li was declared free of the disease, but it was a life-altering experience. He's now a volunteer for the university initiative, handing out leaflets and sharing his knowledge with fellow students. He's helped by Wang Yatong, who's also a student at the Beijing Sports University. She's one of the so-called double-cross volunteers who speaks regularly to fellow students about the dangers of tuberculosis.
Time to spare, money to make, respect to earn.
When she's not volunteering or attending class, Wang, like so many other students here, shares a confined dorm room that is ideal for developing close friendships, but also for spreading TB. Wang has seen the dangers and has decided to do something about it.
我觉得结核病在大学好像，如果一旦有一个人发病，如果不注意的话，可能会影响到很多周围的人吧。我觉得如果我加入的话，能够通过我自己的方式吧，去影响一下其他人，让大家就是提高一点防范意识。
While the university initiative has helped many college students here, fighting TB in such a vast country is a major challenge. Chen Li is already spreading the word, not just in college, but farther afield as well. He's heading home to Sichuan province where his family lives. On the way, he takes every opportunity to stop people and tell them about the dangers of TB. As Chen gets further into the countryside, knowledge of the disease becomes as slim as the need is great. 80% of TB patients in China live in rural areas, where it's more difficult to supply and administer the daily regimens of drugs to combat the infection. But Chen's family is an exception. Their loved ones' brush with TB taught them all a lesson and left Chen a better man.
这样对这种是吧，也算是疾病的考验之后吧，我对这个生活充满了向往，积极的，反正非常积极乐观的去面对生活中的种种困难。我觉得，在困难是压不倒我的，我觉得会积极的去面对，会去征服一切困难吧。
A positive attitude, coupled with the knowledge and tools to make a difference. That's the message that Chen, with the help of the Lilly MDR-TB partnership, is spreading to bring this terrible disease under control. As the Chinese proverb goes, one generation plants the trees and another gets the shade.